What we said for J&J is that if you're 2 months out of your last shot, you are eligible for a booster. And then finally, this plan to have recommendations towards mix and matching. The FDA and the CDC saw a lot of data over the last week. We saw data from the NIH on mix and match that antibody levels for the mRNA vaccines boosting the J&J were really, really high. And we also saw clinical data from J&J that said if you're boosted with J&J, you actually do quite well as well, which is why we've really left it open and said any one of these vaccines can really be used to boost any one of the others. We'd be studying that, but what we do know is that it looks very effective. It looks effective in the clinical studies, it looks effective in the antibody studies, and it looks very safe as well. Is there an absolute preference for one or another if you got an mRNA vaccine versus a Johnson & Johnson vaccine? We really do see great clinical benefit for both. Shot, and we are vaccinating them at about 250,000 a day. We are continuing active outreach, active communication, active discussions with trusted messengers to really work to scale that up. In the meantime, in parallel and without losing any of that effort in getting people vaccinated for the first time, we are rolling out this booster plan, and people are coming. They are interested in getting their boosters. This week, they will have a lot of science to review, and over the coming week, we are hopeful to hear from them by the beginning of the following week, and that's when the CDC will have their meeting, and I will be ready to take action if all of that goes smoothly as soon as possible. In the meantime, the administration is working on the operations and the logistics, so as soon as we have both the FDA authorization and the CDC recommendations, there will be vaccine out there so children can start rolling up their sleeves. In fact, those survey data look very much consistent with where we were with adults in last December when we rolled out vaccines for adults. So we have done a huge amount of hard work over the last 10 months, education, communication, providing information, getting vaccines to really convenient places, trusted messengers, making sure those vaccines are in pediatricians' offices and children's hospitals and pharmacies where parents trust vaccines being given. And so we're doing absolutely all of that hard work now, and we have that hard work to come for both our children as well as our parents and for the 64 million people who have yet to roll up the sleeve of COVID, and we are still having death rates of about 1,200 to 1,500 deaths per day. As we roll out these vaccines for our children, and we are hopeful that we will be able to, it's also critically important that our kids are able to stay in school. We saw just a couple of weeks ago new science that demonstrated that schools that masked had 3.5 times less likelihood of having outbreaks than schools that didn't. And so in my mind, the most important thing right now, as we work to get our cases down, as we work to get our children vaccinated, is that we continue the masking to keep our kids in school. With themselves, if they are vaccinated and they are not wearing a mask, they are safe. Did you